In your medical news this morning, Wisconsin reporting its first child flu death of the season. State health officials say respiratory illnesses are running high right now. RSV is hitting young children particularly hard. Nearly 6% of emergency room visits for kids under 5 involve RSV, they say. State health Officer Paula Tran expressed her condolences to the family, noting the child did have underlying health conditions. Officials are urging everybody 6 months and older to get vaccinated.
Vaccination is the best way to prevent complications like hospitalizations and, in this case, unfortunately, death. If you have not been vaccinated, I would strongly suggest that you consider at this particular point, not only for the person itself, but for those people who are around you.
Nationwide, there have been 16 pediatric deaths tied to influenza this season. And a new report from the American Cancer Society shows that while cancer deaths continue to drop, there are significant concerns for increasing cases of certain cancers, especially among women and younger adults. Michael George has those details.
3 years ago, Tiffany White was diagnosed with endometrial cancer, a type of uterine cancer. She was 28 years old.
For years, I was actually misdiagnosed. So I would go to the doctor often and have these really chronic menstrual cycles. And no one could figure out what was wrong.
She had 6 surgeries, radiation, and then suffered a stroke.
When it was over, I'm in menopause at 31. So a lot of the things that other people my age are experiencing, I can't experience. Can't carry children. And so emotionally, it has been a roller coaster.
While overall death rates for all cancers are declining thanks to early detection and treatment advances, the American Cancer Society says progress is being threatened by increases in several cancers, including uterine cancer, especially among women and younger adults.
Really striking in this report is an increase in the number of women being diagnosed with cancer in the 50 to 64 age. It's particularly striking in younger women.
Rates in women under 50 are now 82% higher than men. The report also highlights death rates rising for oral cavity, pancreatic, and uterine cancers.
Uterine cancer, it's a cancer with a very large disparity in outcomes between Black and white Americans. It's a cancer because of the importance of estrogen driving it, that there are also links to obesity, but there aren't deep population-based studies that we can say that for sure.
Feel like someone is not listening to you, go to someone else. If I had not gone to multiple doctors, I probably wouldn't be sitting here talking to you all today.
Tiffany says she hopes sharing her story raises awareness and encourages others, especially Black women, to advocate for themselves.
The report also shows Black Americans are twice as likely to die of prostate, stomach, and uterine cancers compared to white Americans, and 50% are more likely to die from cervical cancer. That's a cancer that can be detected early and prevented with vaccination.